Good morning. It's News from the Roots on Mountain Stream TV. Today is Monday, January 29th, 2018. I'm Avram Friedman. This morning we have two special guests. We have Roger Turner and Ellen Kazmarek from Asheville, who have been working on spreading the word about single-payer universal health care in America. And we'll be talking with them for the next hour or so. And I have a few announcements first before we begin this conversation. The HK on J, or Moral March on Raleigh, is taking place this year on Saturday, February 10th. This is an annual march put on by the NAACP and Friends. There's a vast coalition of groups behind this. Last year there were upwards of 100,000 people who attended, and we're hoping to duplicate that or even get bigger this year. We have buses leaving from Weston, North Carolina, including one here from Silva. The Jackson County branch of the NAACP is sponsoring this bus. It's leaving at 3 o'clock in the morning from the Jackson County Justice Center. And you can get on this bus. You can make a reservation. We're asking $50 for a round-trip ticket. However, there are scholarships available if you can't afford that, and we'll take a partial payment from you, or even if you don't have any money, we want you to get on the bus because we don't want anybody to go because they can't afford to. So if you would like to purchase a ticket or make a reservation on the bus, please call the Canary Coalition at 828-631-3447 or email info@canarycoalition.org. That's Saturday, February 10th, to go to the HK on J, which stands for Historic Thousands on Jones Street. Jones Street is the seat of government in Raleigh. It's where the legislative building is and the executive offices and the judicial branches in that district as well. Today on Mountain Stream TV, after News from the Roots, we'll have our feature presentation, which is Doug Woodward, reading at City Lights bookstore from his new book, You Took the Kids Where? and it's an autobiographical book about places of adventure they went for vacation in which they took their kids. And it's a wild book, and it was a great reading, and I hope you'll join us for that. And since this is our feature, you can go to mountainstream.tv and hit the link at any time during the day or night and see that if you can't make it at 10 o'clock this morning. And then at 10:50 a.m. we'll be watching a 2017 ginseng marketplace that was organized by Robert Itis and in conjunction with the Madison County Agricultural Extension Agency. And this is all about the up-to-date information about how to grow wild-crafted ginseng and how to make value-enhanced products and how to enter into the marketplace and what are some of the legalities involved there as well. Very interesting conversation and forum. At 2 p.m. we'll be watching the 2017 Moral March on Raleigh, including a magnificent speech, powerful speech by Reverend William Barber II. And then at 4:40 p.m. we'll be watching a documentary done by the Canary Coalition about the opposition to the Atlantic Coast Pipeline. There's a natural gas pipeline being planned by Duke Energy and Dominion Power that will bring fracked natural gas from West Virginia down through Virginia and into eastern North Carolina, where it will feed a series of proposed natural gas power plants that Duke Energy wants to build with your great payments. And that will be, it's called Stop the Fracking ACP, and that will be on at 4:40 p.m. It's a 28-minute documentary, and that's our programming for today. So, Roger and Ellen, thank you for joining us this morning, and tell us what you're up to. I know there's a big movement nationwide being pushed by Senator Sanders and others in Congress that's really gaining traction in many quarters, and even members of the business community are getting involved in this. Tell us what you're doing.
You want to go ahead and explain who we are, as
Yeah.
a chapter of the Physicians for National Healthcare.
Right, and let me just give you a little bit of background about
Yes.
how we started and what we've been up to. So last year, when Indivisible.org really took hold and there was some traction in Asheville for it, we came together with 500 of our comrades in a room at Pack Library and basically divided up into like the 14 to 15 different areas that we were concerned would be trampled by the new administration when they came in. One of these happened to be healthcare, to which I gravitated. There were probably another 50 people that also gravitated to the healthcare setting, and we decided that there were too many of us to actually just kind of lump ourselves as healthcare, so we subdivided. And the subdivision that I chose is the single-payer plan, Healthcare for All, Medicare for All, called by a variety of different names.
Yeah.
So we started meeting then, and essentially what we did was very, very kind of rudimentary discussions around, what do we do with the Healthcare for All concept in Western North Carolina to move it forward. We decided that our best role was going to be an educational one rather than a political one, because it's hard to get people to vote for something they don't understand. Though people do that all the time, if you're really doing this as an educated voter, you should understand the issues that you're voting for or against. So that being kept in mind, we proposed that we would educate ourselves first, and we moved that forward. There were 3 of us initially, under the aegis of Indivisible.org. Moved it forward, went to some seminars in Charlotte that were hosted by Healthcare Justice NC, which is a chapter of Physicians for a National Health Program, which is a national motion.
And that's
movement.
pnhp.org. They have a great website for anyone that
Absolutely.
wants to be educated. This is a great website to start with. And we are now a regional chapter of that organization, pnhp.org. And it's a wonderful organization. They've been advocating for single payer since 1986. And they have, 24,000 members nationally. It's not restricted. You don't have to be a healthcare professional. In fact, a lot of our members are not healthcare professionals.
However, you both are. You are a physician, Ellen.
Yes.
And Roger, you've been in physical therapy.
I was a former physical therapy assistant in Macon County. I did home health care, but worked in several counties out west. It was when I was living in Silva, of course. So yes, we're both. I'm quasi now. I'm semi-retired.
Yes. So, what we did with the educational piece is that we morphed it into a series of symposia. The first one was Healthcare for All, a workable solution, which Carol Paris came into. She's the physician who's the head of the Physicians for National Health.
She's the president of PNHP.
PNHP now, right. And Jessica Shore-Sachs, who is the leader for the Charlotte chapter. She also came in to speak, along with several of us who were either physicians or healthcare providers or healthcare consumers in the Asheville area. That was done last June over at AB Tech's Ferguson Auditorium. There is a link on our website to see that, a video of that conference as well. The second thing that we did was we had the movie Fix It at Pack Library, which Roger is going to tell you a little bit more about in a minute.
Was it the same one that's showing in Pleasant?
Yes.
Oh, I didn't know that.
Yes.
Okay.
Yeah.
Okay.
And then we did a third event in October. It was Healthcare for All.
A moral obligation. Question mark.
Right. And this was, and the one that we have upcoming at the end of February is Healthcare for All, Good for Business. So what we've done is to take a look at the aspects of the Healthcare for All, single payer / Medicare for All issue from a variety of different viewpoints. That could be, again, everybody, it doesn't speak to everybody to be talking to the economics of the situation. It doesn't speak to everybody to talk to the moral aspects of the situation. So we really have been looking at how best to get our message out to people from a variety of different, looking at the different facets. So that's pretty much who we are and where we are.
And so you mentioned that what is your web page? What's the call letters of your web page?
So for right now, if you go to pnhp.org, there's a link.
Okay.
Yes,
There's a link to our
and that's
chapter.
the national organization that we're a chapter of. There's a link to us.
So if you go on that website, go to the state of North Carolina, they'll show 3 chapters of their organization, one being Healthcare for All, WNC. That's our link. So that's how you get to that.
Okay.
Yeah.
And so do you have an office now set up in Ashland, or is it just individual?
No, we really
Yep.
started in March of last year, so it's even less than a year.
Okay.
So we just launched the website. We also have you can also contact us via the email address, which is hcfawnc@gmail.com.
Okay.
It's just all the single initials for
Yeah.
healthcare.
We'll have
Healthcare
to
for all
repeat that again.
Right.
Yeah,
Yeah.
that's
Maybe
fine.
several times.
That's the
Fine.
email, and of course we are trying to grow the volunteer base, which any grassroots organization depends on its volunteers.
Sure. Yeah. So, what specific activities are you doing right now? Do you have regular meetings?
We're okay. The meetings are not regular yet, but we're working on that. The meetings are generally they coincide with the events that we're working on. So, in other words, we're going to be having a meeting this Tuesday, tomorrow, about the event. Our next event is Healthcare for All, Good for Business, dollar signs for business,
Right.
and we're having business leaders that are going to be speaking about why healthcare is good, why single payer is really good, really benefits business. And I'm pleased to say that we're getting David Steele, who is from Pennsylvania. He's a former Republican legislator from Pennsylvania who was the former president of Healthcare for All, PA, Pennsylvania. He's coming from Pennsylvania to be our keynote speaker on February 27th, which is a Tuesday, at AB Tech at the Ferguson Auditorium, and that's a Tuesday and starting at 7 o'clock. So, and David Steele also will be appearing in the movie Fix It, Healthcare at a Tipping Point, which is going to be showing again in Flat Rock at the Flat Rock Cinema on February 12th. And go to our website for details about that. And it's the same movie we showed. I didn't realize that was the same movie.
Right.
And that's a very business perspective on why healthcare is good, because business is a key player here now, especially. And I've always looked on single payer Medicare for All as a great bridge issue to reach outside of our choir, if you want to call it a choir,
Right.
because I think it's something. Its time has come. Look at the growth in Congress when Bernie Sanders introduced that legislation. How many years ago? The very first time, no co-sponsors. He was the only one that introduced it. He's got 16 now in the Senate. The Conyers bill in 2015 had 48 co-sponsors. It's now 120. So,
Which is a majority of Democrats in the House.
I would say so. I would say so. And
It is.
again,
Yeah.
I think this is a bridge issue to reach across the aisle. I think it's getting more and more obvious that this system is just so broken. I'm just going to throw this in as one of my little factoids. 62% of all household bankruptcies are due to medical expenses. 62%, and we should never allow this. Really, we're the only country, the only country in the industrialized world that does not have some kind of universal healthcare system.
So many people who are watching this probably also watched the town hall meeting that Bernie Sanders put on last week,
Which I missed.
And one of the things that was striking was this panel of business people who are on there and talked about why it just makes so much sense for the business community. And so this is part of a conservative
Yes.
argument for
Yes.
Medicare for All. Would you expound on that a little bit? Why is it good for the business community to be promoting single-payer healthcare systems?
Well, what happens in a business community is, anytime you're looking at your business, you're trying to make sure that you're cutting the expenses in order to improve your profit margin. And so, if you can't expand the places that you're selling, then you're having to contain your own expenses to really be able to meet your bottom line. The problem with healthcare costs is that they have been increasing greater than the GDP since, at least the beginning of the 2000s and probably before that. I know I've seen the statistics for it. So what happens is there's been this runaway cost for healthcare, and if you're an employer who provides healthcare benefits to your employees, there's no way to really predict what's going to be happening for your next year. So you never know what your overhead's going to be. You've got an HR person who's going to have to be dedicated to reviewing all of the plans that are out there, and it's an ever-changing landscape for what's going to be available. If you have one catastrophic illness with an employee in your company, you can expect that you're going to have a vast increase in what you're going to be paying out the next year for your health insurances. So there's no way to really look at that and control what's happening. The Fix-It movie, again, as Roger had referred to before, is an excellent way to really look at the business community, through the business community's eyes, at what happens with their expenses. So you're not only putting manpower hours to work, having the HR people and everybody else scurry around trying to figure this out, but then you're also got increasing expenses all the time for providing those. So what are your options then? You drop back to part-time people that really are not going to have any loyalty to you if they don't have benefits. So then you're spinning your wheels again because you're having to retrain people all the time because they don't want to stay there.
So it's having to provide health care for your employees is a tremendous burden on all businesses that have to provide it.
Under the system that we're in now.
Under the system that we're under
exactly
now.
Right.
And not only is it a financial burden, but it's a bureaucratic burden because the paperwork is tremendous, and very often somebody has to be hired just to take
set up a healthcare plan for your employee. Yeah.
And so as a result, a point that was made during this town hall meeting was that on a grand scale, this is making American businesses less competitive on the international market because almost every other industrialized country in the world provides this service for businesses, and so that they don't have to deal with this. But in our archaic system here, our barbaric system here,
the free market system,
we don't. So while it's being portrayed in many ways as helping just poor people and people who don't carry their weight or whatever the conservative argument is, it's actually just as much of a burden or more on the business community.
Absolutely.
And that is trickling down, if you will, to everybody else.
Yeah, I think on average, it's 17% of your payroll is taken up by insurance premiums. Companies providing health insurance for their employees. 17% of their payroll is health insurance. I remember an article that I've kept for years. It was 2004. Public Citizen came out with an article about how you get automakers, the big three, whatever. They go to Canada and it's single payer, and they save incredible savings. They make the same car for $1,500 less because of health insurance. Is what they don't pay, in Canada. So it's been known. Business has known this for years, but they come back to the States, and they're, big pharmacy, big pharma, and health insurance companies are huge clout. Currently, the health insurance industry has 700 lobbyists in D.C. They spend between $60 and $80 million a year on lobbying. Drain that swamp. And it's huge, the clout they have. They stopped it in California. Single payer was going to be, they had introduced single payer bills, acts in California, and probably arguably the most progressive state in the country.
Right.
And even there, they couldn't pass it because of the blowback.
So once again, this is another the root cause being the Citizens United decision of the Supreme Court and the allowing of flooding of money into politics from corporate interests to influence and buy politicians and buy elections.
Well, it's been going on for so much longer than that, though, because historically, one of the things, you know, you can go back into the 30s and 40s to look at employer-based healthcare programs. I mean, it was an incentive then to keep people, if they couldn't increase their wages above a certain amount at that time in the 30s and 40s, one of the things that they could do to win people's allegiance and keep them where they were within the company was to offer healthcare benefits, because they really couldn't afford to do, and healthcare benefits to buy those at that time cost nothing. So what we ended up with was kind of this historical look back at keeping the employers the basis for how to achieve your health care. Things exploded then in the early 80s when Reagan said you could privatize, the healthcare corporations could become for-profit, the insurance companies could become for-profit. So that really kind of opened the market wide.
Prior to Reagan,
they were
health insurance companies were non-profit organizations?
Yeah.
That's new to me.
I didn't know that either.
That's fascinating.
So it's just been a, you know, Mr. Toad's wild ride in terms of what's happened. And, you know, thinking back on it, maybe that's actually when we started seeing the GDP rising at a much slower rate than the healthcare costs have. Again, because the profit incentive and motive for these corporations has been huge. There are statistics. Again, if people go back and take a look at our website and click on the first video that we had, which was the Healthcare for All, the workable solution, there are statistics about how much the CEOs for the insurance companies make per week. It's obscene. It's in the tens of thousands, and in some cases hundreds of thousands of dollars a week for the CEOs of the major healthcare organizations.
Their average annual income is $20 million. Average CEO income.
That's amazing. And so, like, there are several reasons why for-profit, I mean, the Medicare for All system would be less expensive than a for-profit industry. Obviously, you don't have these huge administrative costs, paying bonuses and incredible salaries. You also don't have advertising costs. You don't have lobbying costs, which are in the hundreds of millions of dollars. And you have this grand economy of scale that you're creating with the Medicare for All system. It's the largest group that it possibly could be.
Let me interject. Okay, good for business. You know, people. One of the opposing arguments you always hear as well. It's going to bring in socialism. You know, we're going to become a socialist country, and you give up your life. You know, we already have socialism in healthcare. The VA system, the Veterans Administration system, is socialism. It's a system controlled by the federal government, and this is one of the key things that's going on here. I mean, from my opinion, is that people just are not comfortable with government. You know, they consider government to be an overreaching thing that, you know, if you put government next to corporations, I'd go with government any part of the day. At least I could vote government out, hopefully. But
certainly in healthcare.
Yeah, but anyways, I just want people to realize that socialism is working in this country, that the VA system is a socialist system.
So is Medicare.
To some extent. And Medicare, not quite so much. Medicare is more like a single-payer system. Socialism, which is in the UK, in Britain, not in France or Germany or Spain or Canada. That's a single-payer system where the government does not own the doctor. They do not, you know, that's another concern is that people think, oh, if it's single-payer, I won't have any control over who I choose. You have absolute choice as to your medical delivery. Single-payer, it's publicly funded, privately delivered. So it doesn't change the relationship between the doctor and the patient. Not at all.
And that's the differentiation, as Roger had said, between the VA system and what we're talking about. The VA system is publicly funded and publicly delivered, because the
I
federal
see,
government
I see.
owns
That's right.
the
That's
delivery system.
Those doctors work for the government.
Exactly, and they own all the hospital systems, and they own the whole healthcare industry basically that filters through the VA system. So we're talking about, and that's what the UK system is. That's a nationalized health system.
Yeah.
So what we're looking at is something where you would be, again, administered your card when you were born, and what would happen would be you would take that card anywhere in the United States and get health care.
And it's not.
And you wouldn't have a copay, you wouldn't have a deductible, you wouldn't be paying out-of-pocket expenses, and again, the coverage would be pretty comprehensive as far as what you could get with it. Dental, vision, all of your rehab services.
I think it even covers long-term care. I think it would.
It does in other countries. It kind of depends on how it's
I mean, that's a
crafted.
work in progress,
Right,
But yeah.
right. So it's and you don't have to think about it. One of the things that the costs to the American people that it's rarely stated is the anxiety factor. So if you take away the piece where people are anxious about how they're going to pay for their healthcare costs, and as Roger said, over 60% of the bankruptcies in the United States are because of health-related expenditures. So if you take away the worry about, I can't change my job because I won't have health care, think about the entrepreneurial creativity that could arise from that if people were free to pursue what they really wanted to pursue and not have to have just that holding them to what they were doing.
It's not job-based.
Huge.
It's not job-based.
Huge.
You can, it's huge. I mean, you can leave your job if you're not happy. Because how many people stay with that job because you lose your health benefits? Health insurance premiums since 1999 have gone up 213% since '99, and the average in 2002, the average household family, 4 people, what they spent on health care. Let me just look briefly at this. It's pretty interesting. Yeah. Okay. In 2002, it was $9,200 a year in health care. By 2014. It's $23,200.
This is for like a family of 4?
Yes, for a family of 4. So that's an increase of 250%.
Yeah.
Since 2002. So, it's huge, really. Back to the VA, just one last point, which is really interesting, because in single payer, when you have one payer, you can negotiate drug prices. The VA, their prices are 40% less for drugs than what we pay.
So the VA is allowed to do that, but
yes.
In Medicare, the government is not allowed to.
That's right.
negotiate.
That's right. But if you can, the VA has the power because they represent that chunk of people,
Now, there are those who criticize the VA. They say it has shortcomings and long waiting times, but that can be traced pretty much to the fact that it's underfunded, correct?
And there can be management problems in certain VAs. Let me add that the VA in Asheville, in Otine, is considered one of the 2 best VAs in the whole country. So, I've actually done some voter stuff there at the VA, and it's amazing how many people come in from outside the region. From South Carolina, Georgia, Tennessee. They actually come to Asheville because it's such a great VA. And it's their insurance again it's portable. I mean, a veteran can go anywhere in the country and get coverage.
Yeah, that's tremendous.
And that's what single payer is sort of opening up. That's another way to get into that.
Right. And also, I think it's an unfair criticism of the VA in that, waiting times in the private sector are horrendous. And not only that, but the conservatives often talk about the rationing of health care that takes place through a single-payer system or through their eyes. But the fact is that
it's already rationed.
Today there is rationing,
Absolutely.
But it's based on economics. It's not based on need.
Absolutely.
It's based on who can pay for it.
Because some people just never get to the doctor because they're afraid of what the cost is going to be, or what not afraid. They did because they can't afford it, basically, and so they just don't go. And Bernie Sanders again made a tremendous point that a lot of people delay a trip to the doctor
Absolutely.
because they're afraid of the cost.
Absolutely.
And what happens then is that it exacerbates their illness, whatever it is. If it's cancer or anything, the disease progresses until it reaches a crisis point, and then it becomes much more expensive for the individual and for the system in general. So we're wasting a tremendous amount of money by having this system in which people are afraid to visit a doctor.
Absolutely.
Well, I thank you for bringing that up, because that's actually one of my points whenever I'm talking about this. I'm a geriatric physician.
Yeah.
So essentially what but I started out working in a federally qualified health center when National Health Service Corps was placing people. This would have been in the early 80s. So what I started out was seeing people who were really, on the far margins of society and couldn't afford health care, and the physicians trying to cobble together whatever we could to try and keep, make people as healthy as we could. And then my future career evolved into becoming a geriatric physician, where everybody had the golden ticket of a Medicare card. So what had happened was a lot of people who had been, maybe the same clientele that I had taken care of when I was seeing folks in the federally qualified health center, who had kind of been cobbled together and maybe not well or they hadn't come in to see us, had put off getting diagnoses and treatments until they had that ticket at 65. And then the horse is out of the barn. So, has their diabetes wreaked havoc on their eyes and their kidneys and whatever else because it had never been diagnosed? What's high blood pressure done to them in the meantime? Have they had small strokes that they hadn't been aware of, or had been aware of but couldn't have taken care of? Did they have a cancer, like you said, that had evolved to a stage? So, the relief that people have when they get their Medicare card is palpable for a lot of people. And why doesn't everybody have that from the get-go? Why do we make people really suffer until they get to the point where we say, you're old enough to get one now? Okay. Really?
Yeah. And it's not just the people who are suffering. Again, it's the whole system becomes overburdened by these...
Absolutely.
It's all emergency. All we're dealing with is the crisis now, rather than the prevention.
Exactly right. And that's where you can turn your monies back into, is the primary care and the preventive nature, which is what medicine should be all along, from birth on.
We have a wonderful, one of our members is Dr. Marcia Fretwell, and she wrote a great op-ed, appeared in the Asheville Citizen Times.
I got a copy of it.
And it's called The Last Happy Doctor in North Carolina, because another perspective that no one thinks about is from the doctor's perspective. How many doctors are being driven out of their practices because dealing with health insurance companies is pretty stressful. And
very expensive for you.
And the administrative costs to your own business dealing with the health insurance company. So Marcia, basically, what did she do? She basically got out of the health insurance. She went to Medicare, Medicaid. What was it?
No, she's a geriatrician as well. So she opened her own office where she could see people for as long as she deemed necessary, which was a half an hour minimum per patient encounter, which is a huge amount if you're in kind of a factory frame of mind.
Which is what happens with the current system. It is a factory.
Right. And she also, because she was billing primarily through Medicare, because that's the population she dealt with as well, it really minimizes the number of people that you need in your office to be filing secondary insurance.
So it made a huge difference to her own practice, because what's happening is that there's, people talk about the opioid,
the opioid
epidemic.
Yes.
The other epidemic is that doctors are leaving their professions.
Absolutely.
I mean, there's a huge outflux of doctors.
And why is that?
Because they're being, from my standpoint and from what Marcia's saying is that dealing with health insurance companies, you spend so much time on the phone with these people.
So it's the stress and just the...
and you have no time to deal with what you really want to do is work with your patient. It just ruins the patient-doctor sort of relationship.
Well, the documentation that goes into being able to support the payments that you're going to be getting, potentially, if you filed all your paperwork correctly, have all the T's dotted, T's T's crossed and I's dotted.
Yeah.
It's both overhead in your office because you're employing X number of extra people. It's what you have to deal with a shorter period of time to see to do patient-related stuff versus the documentation.
It emphasizes, this current system emphasizes the business aspect of the medical profession more than the actual healthcare and healing role of
and you probably know this, that 30 to 35% of every healthcare dollar now goes to administrative costs, including advertising, whatever, or lobbying, whatever you want to call that. But that's a third of your dollar is going to health insurance.
That's tremendous wastage.
There's I harken back to the Fix It movie again, which, by the way, you can queue up yourself online. It's Fix It Healthcare at the Tipping Point movie, and you can watch it yourself.
Yeah,
on YouTube.
Mm-hmm.
Yeah, and it's not a YouTube; it's their own Vimeo production.
Oh, Vimeo. Okay.
Yeah. So, but it does talk about a woman who had a physician that had gone from, I think, Washington State into British Columbia to practice medicine, and just the decrease in the stress level for her because of, again, the documentation necessary, the time not being able to be spent with person-to-person care versus physician-to-computer care, and just how quick it was to get reimbursement. It's impressive. I really like this movie because it looks at a number of different aspects of why is it a smart idea to move into a single payer plan.
So let's talk a little bit about how we get there.
Yeah, baby.
There's the rub. Actually, all right. Well, the thing is, this guy that's speaking on February 27th, David Steele, he has been instrumental in several introductions of single-payer bills in the Pennsylvania legislature that never have passed, but they've introduced. And basically, the way you fund this program is that, yes, your taxes will go up slightly, and I'd say, and I think Bernie has 2-point-something%, let's say between 2 and 3%, personal income goes up slightly. The rest is also paid from payroll taxes. All right, so your employer will be paying. But in the current system, businesses are paying 70% of payroll goes into health insurance. David Steele, in his legislation, payroll taxes will be 10%, which is 7% less than what they're now paying. Pretty huge, I'd say. Personal income will, let's say, be 3%. Okay. The average family of 4 will pay $1,100 more in taxes to pay for their health insurance versus what they're paying now, which is close to $8,000 is what the average family paying now, something like that.
Okay.
So people just don't get it. They don't. I don't know why they didn't see this in California, but obviously there was a lot of opposition.
But I think it's important to mention, so that $1,100 that you're paying as additional taxes is offset by the fact that you no longer are
deductibles,
right?
All that complicated stuff that you're dealing with.
It's more than offset.
Actually,
actually,
you're paying
exactly right.
Paying less.
Lower premiums plus no copays.
That's right.
No deductibles.
That's right.
That's right.
Exactly
It gets rid of all that.
Right.
All that bureaucracy, which
right.
So I go ahead.
Well, and again, people who are underemployed, unemployed, there are certainly safety nets for everybody. I mean, it's not like, if you're not employed, then you're not going to be getting the insurances, or you're not a taxpayer who's going to pay in that income, in that bracket at this point. Everybody's taken care of. Everybody.
And we're talking about incomes now. This thing about the average family will be paying $1,100 in taxes. That's for incomes under $200,000, and I think for a couple it's $250,000. Okay. Now, 90% of Americans will see a decrease in their health care costs. Now, there will be the upper maybe 10%
Yeah, they'll
of
pay
income,
more.
they will pay more
They can
in
afford
taxes.
to pay more.
And they can, exactly.
Right.
So, but the great majority of Americans will see a savings, even though their taxes go up. And this is the big bugaboo. I mean, you know how people are about, they're raising taxes, but they've got to see the correlation.
Right, and it's not a small savings; it's a big savings.
It's a huge savings.
And it's not rocket science.
And if people, I think, understand that, and I think people are beginning to understand
I
that
hope
because
so.
poll after poll after poll now is showing that a majority of people favor a single-payer Medicare for all health care system.
Right.
So the question again is okay, how do we get there now? We have a government which, frankly, is no longer of, by, and for the people. We don't live in a democracy anymore, or not at the moment anyway. Maybe we can take it back. But
again, this is the issue for me that should.
it's not just Republicans. Yeah.
Right.
No, you're right. You're right.
Yeah, absolutely. No, but this is the issue to me that crosses that great divide. If people can see this, and I think if it can succeed, if it will pass in one state, I think it'll be a stampede.
Well,
I really do. Once people get over this thing about taxation,
So you
and
think
they
state by
actually
state
see,
is the way to go.
it's going to have to be, I think, at the current,
Ellen seems to disagree.
I think one of the problems is when you look at state by state, what you're not able to factor in is as the economy of scale that you get from a federal as a federal program, and if you're burdening the state to take it on, why don't people just move into the state then? So one of the things I think it's if you attempt to do it state by state, I think you're really missing the point of if we have a federal system, how much more can be saved. Because like in California, it didn't pass because the legislature couldn't vote for that kind of a tax increase across the board, and that's going to happen in every state. But if you look at it on a federal level, because we can, there's not going to be movement between the states in order to, people aren't going to flock to North Carolina because we're the only state that's passed it, for instance. So there's just, you can't achieve the same economy of scale if you're doing it state by state.
I think, from my perspective, I think what we started to talk about earlier is I think that we have to work through the business community.
Yeah.
I think if we can bring over the business community in general to understand the savings that they will make and how it's going to make them more competitive on the world market and eliminate this tremendous bureaucratic headache for them, that will bring the government along with them.
And I think it's interesting that, in the present administration, what's happened is they have changed the taxation systems, and they've tried to make sure that, tariffs being what tariffs are, that it now favors kind of, people moving back into the United States, the way that their corporations can be set up. But if you don't get a handle on the healthcare dollar, no matter what you do in terms of incentivizing people to keep their corporations here, they still can't control for the expenses if they're covering the healthcare for their employees.
Right.
So no matter what, it's kind of like shooting yourself in the foot. Yeah, okay, good. So stay in the United States, but we're still going to be charging you like you don't know what for the next year to.
And another aspect that we really haven't even touched on is public health in general. I mean, look what's happening right now with this flu epidemic, for instance. People are dying, and there's people. My partner, Kerry Rayburn, is currently has the flu. She works for the agricultural extension, for the cooperative extension agency in town, and they don't have a secretary right now because she's out. She's going to be out for 2 weeks. I mean, wiped out. Well, that's happening all over the country. What's that costing our economy in productivity? If you want to just look at it from a business perspective, you know.
Mm-hmm.
But I mean, if you have a population in which the poorest people and the most low-income people cannot afford health care,
Right.
it's going to impact everybody.
Yeah.
Because you're going to have epidemics of what is happening right now. Public health is being impacted, you know. And any way you look at it, you know, it may not immediately show up on your bank account, you know,
Right.
if you're a business, but it will, you know. And it's you know, it's like you're witnessing the downfall of a civilization if you're not taking care of health care for everybody.
It's funny, in the latest, the Republican tax bill, they, you know, bless them, they provided for CHIP, Children's Health Insurance Program. They're going to continue
Ultimately,
funding.
they did.
But are they going to fund the health care centers, public health care centers
Right.
that distribute this?
Right.
No, that gets cut.
Right.
So,
Right.
you know, and again, we basically are really trying to be a nonpartisan group. You know, Healthcare for All, WNC. It's got to be nonpartisan. We've got to be able to reach across that divide. And this is the issue. I mean, for me,
there's every reason for it to be
Yeah.
nonpartisan, because it's not just Republicans who are
It's exactly
resisting
right.
Medicare for all. Yes, there
Yes.
were 16 senators that co-sponsored Bernie Sanders legislation, but that means that there were 70 something,
Yeah,
something
right,
that, or 80 something that did
right.
not, you know, and a lot of them are Democrats,
Right,
you know, and I think there are some Republicans who are leaning toward it right now, even though they may be afraid
Yeah.
to say so in the
Yeah.
current political climate. But I think you need to change the political climate, you know,
Well,
and take away the concept that it's socialized medicine. You know.
Oh yeah, that's
you know,
been,
that's an anachronistic term.
You won't believe how long that's been used as the
Sure.
argument. I mean, I'm talking 100 years. They've been using the same argument, you know.
Right.
And I think finally, I mean, hopefully, it is at the tipping point. Healthcare is at the tipping point, and I think it is good for business. And business, I think, is waking up to this.
I
you
think
know.
so too.
Finally, I mean,
Yeah.
really, it's taken quite a long time, because that article that I made a reference to about our automakers in Canada, that was, you know,
Right, that was
14
no
years
three.
ago.
Yeah,
They were
yeah,
they
yeah.
were realizing
Yeah.
that was true.
Yeah.
You know.
So we need to be talking to chambers of commerce.
Yes.
Absolutely.
You know, and,
Absolutely.
Yes.
and other business
Rotary.
organizations.
Yep.
That's right.
And that's
Rotary.
partly what we're doing.
with
you know.
this economic
Message.
argument
Yes.
for the businesses,
Yes.
and showing charts and comparisons between American companies and European companies and other, you know, Taiwanese. And, supposedly the Taiwanese have one of the best healthcare systems in the
That's
Which
world.
was
right.
modeled,
That's right.
which we provided the information for, interestingly enough.
Because of
So it
Medicare?
was
No.
it was some of the Medicare, what you call it, the U.S. health consultants helped the Taiwanese develop their system for their health
Isn't that
insurance
interesting?
package. Yeah. So why can't we implement this here? I mean, you know, the other thing that we had talked about initially was just the different educational pieces that we've done, and probably the one of the more compelling ones is looking at is it a moral obligation to be providing this? If you think about, you know, something as mundane as providing police services, providing, you know, the fire services to a community.
That's socialism.
Well, your taxes
That's
are
right.
going to fund these
Right.
organizations. So build the health. Why isn't healthcare included as something that we have a moral right to expect? You know, I'm expecting that, you know, if there's a fire at my house, I'm going to pick up the phone and call 911, and they're going to show up. So why shouldn't I expect to walk into a hospital if I'm having an emergency, and without looking at my insurance card first, they're going to say, "Come on in, we'll take care of you. It's done."
Yeah. No,
You know?
it works, makes complete sense.
Yeah. So just, you know, that aspect of it, I'm sorry to say that it's the economics that we pivot on, because, you know, shouldn't it really be the morality and the piece where we're kind of, and this, I may sound like a you know, a snowflake and a bleeding heart liberal. However, you know, that's the reason I got into medicine.
Sure.
That's the reason you're doing what you do now, is to make sure that people understand what the issue is and that everybody needs to be informed and should be covered by something.
Well, I mean, it makes sense from every perspective, from a moral perspective,
Yes.
from an economic,
Yes.
from a political perspective,
Yeah.
because it's popular, and there's no sensible argument against it that I can see.
Well, some people feel that they're giving something to people who haven't earned it. Really?
Yeah, no, that,
Really?
that is a consideration.
Really?
Yeah.
Okay, so,
Well,
that's
comes
such a
to public
specious
health, it's
argument.
biting off your nose to spite your face if
Exactly.
you deny
Yeah.
if you deny health care to people, because it's just going to come back and bite you in the ass. you know?
Yeah. So somebody walks into
Yeah.
a grocery store that hasn't gotten a flu shot,
That's right.
coughs on, the clerk. The clerk is out. Then she's also infected everybody else.
She's
she
handling
works
money
with.
that she's passing on to you that came from other people.
Yes.
Yeah.
So
Yeah.
lots of reasons to just do it. Not many reasons not to.
No. And so-
But I think, what are the latest polling figures? 60% now? Americans have no problem with government running healthcare. And this is a thing that they keep playing on the others, the ones opposed to single payer, is that the government can't run anything successfully. I remember years ago when I would be tabling at a Charles Taylor, the former representative for the 10th
Right.
district. I remember him getting up there and saying, "Oh, the government can't run a two-car funeral." And I kept thinking, well, why are you even in Congress if you
Right.
believe that? And they keep peddling that the government can't do anything right. And of course, with every shutdown, it just reinforces that whole thing about that government is incompetent. And it's just not true. I mean, if you look at the administrative costs from Medicare to private insurance, it's huge. I mean, Medicare is what, 3% administrative costs versus what, 14% or something like that. It's
Oh,
there's
more than
another.
that, more than that.
Yeah.
Yeah.
But yeah, I mean, it just doesn't make any sense at all. And it's just, and a lot of it is framing,
Yes,
that's
absolutely.
done in the news
Absolutely.
media, that's also controlled by corporate interests that
Yep.
have roots in pharmaceutical industry. I mean,
Yeah.
you turn on, it's hard to turn on television without seeing some ad about some pharmaceutical that scares the hell out of you.
Well, and to that point, there's actually there's a follow-up movie to Fix It called Big Pharma,
Oh, yeah.
which is also
Are we showing that?
we will
We are,
be
yeah.
in March
Yeah.
at Pack Library.
And Albert, this is something we need to work on off camera. We'd love to bring Fix It to Silva. So maybe we
Sure.
could work out something. Who would sponsor that? Whatever.
And we'll
We could
be
work
glad
that
if
out.
it's available. We can show it on
Yeah.
the
How
stream
is
TV.
that available? Do we pay for that? I mean, do we pay for
I
that?
can talk to you
Yeah.
about her.
So that's
Well, we'll
something
be
we'd
glad
like
to air it, and certainly we could set up something maybe at the Mad Batter or something like
Yeah.
that.
That'd be great, so that you could have
Yeah.
a Q&A afterwards. Because
Yeah.
I think the dynamic of having people who are live, who can actually ask the questions to other live people.
We can also
is big.
do like a webinar thing
Mhm.
where people can write in
Questions.
questions,
Oh, sure.
things like
Sure.
that.
So I think from the standpoint of our organization, Healthcare for All WNC, I think one of the primary missions is to get to the outside the choir, and we really are going to be trying to get Chamber of Commerce people interested in business people. So this forum is our first step in that direction. I mean, the one that we're doing in February.
Right, to really speak
to get the
directly to the
business
business
people
community.
speaking. Yeah.
And you mentioned the Rotary Club, the
Yes.
Lions Club, all of
Yeah.
those business organizations.
That's
That's where those communities gather, and that's where you can actually have a
Yes, a robust conversation.
robust
Mhm.
and respectful conversation
Mhm.
with people in the business community.
Mhm.
And I think that's a great idea. And I love the work that you're doing. So how can people get involved?
Good question.
Okay, so
There's your.
the first thing that they can do is come to our Healthcare for All Good for Business, and I'm going to let you. I don't know if you can show that on the screen or.
How about here? I'm going to go to the camera and
Want me to hold that
zoom
for
in
you?
on that.
Oh,
Yeah.
okay.
Okay.
I have a bigger.
Oh, here, let's go with the big one.
say,
Yeah.
So this is the production that we're going to be putting on
How's
Tuesday.
that? Right there.
There you go. Yep, that's good. Tuesday, February 27th, 7 to 8:30 p.m. at the Ferguson Auditorium on AB Tech's
Tech.
campus in Asheville. And this will, David Steele is going to be our main speaker. He is a conservative Republican former state legislator from Pennsylvania, who is also the CEO of his own corporation and has been a past president of the Healthcare for All in Pennsylvania. The second thing that they can do is they can go to our, send us an email. It's at
You have something else you want to put up on there? Or?
Yeah, well, let's see if we can, I don't know how close you can get. Our
Let's
email is
try.
down at the bottom.
That's our email address, you know.
It's
HCFAWNC@gmail.com.
Yeah.
exactly right. Send an email, and I'm usually the person who's monitoring the email, so I will reply to you ASAP, and we'll talk about how you can get involved. The other is going to the pnhp.org website, and they will have a link for Healthcare for All WNC.
In North Carolina, just go to the state and it'll be there.
Right,
You know.
go to North Carolina. So our website is filling in. We've got the 2 past seminars that we've done on the website. There are links to the videos for those, as well as just information about our background and, again, more contact info.
Yeah.
Well, okay.
And we thank you for this opportunity too. Thanks.
Oh, well, you're most welcome to what we do here. And
it's like you say, it's like I've heard from I don't know who. If you don't like the news, make your own. I don't know who said that.
Scoop Nisker was a San Francisco disc jockey.
You have finally realized this.
Who gave the news out, and he at the end of each broadcast he would say, "That's the news. If you don't like it, go out and make some of your own."
And we'll report it here for you.
You've been saying that for years, and here you are. You're doing it.
It's ironic, isn't it? Yeah.
But again, so we just want to make sure that Silva and Beyond understands that we embrace your support and also your desires to be involved with us.
We desire to be a regional.
We would love to
regional
come
group,
out
yeah.
and speak to a community group that you have. So if you've got a grouping that you'd like us to speak to, we do have a speakers bureau.
That's wonderful.
So thank you.
Well, Dr. Ellen Kazmarek and Roger Turner, thank you so much for joining us this morning. And
Thank you.
maybe you'll come back and update us sometime soon as the campaign progresses.
Mhm.
And we'll work with you any way we can.
Wonderful.
And I urge everyone to go to that website and write to Ellen and get involved in this most important issue. Thank you.
Thank
You're
you.
here. Thank you.